Hi, everyone. Thanks for being here. Going to give it a few minutes to let people sign on. Okay, I'm going to kick things off while everyone else is signing on. So hi, everyone. Thank you for being here today. My name is Angelica. I am the Director of Membership and Engagement here at the Steamboat Springs Chamber. We're really excited to bring you this webinar today. This is part of a three-part series that we are doing this year about membership and benefits and programs that we offer here at the Chamber. If you have any questions about your chamber membership, or if you're not a chamber member and are interested, please reach out to me after the webinar. I'll provide my name and contact information in the chat. We have two people joining us today. The first person we have joining us is Rich Lawson. He is the co-founder of the Small Association Leadership Alliance, a membership organization serving small staff associations. Rich has been an association management professional and executive for over 20 years, working in various capacities before starting his own consultancy in 2016. And then we also have Julie Silverman here with us. Julie Silverman is a regional sales executive for Sedera. She has spent the last 7 years helping people around the country find more cost-effective ways to pay for healthcare, which promotes individual ownership, flexibility, and direct access to care. So I want to thank them both for being here today with us. If you have any questions, we are going to be taking questions at the end of the presentation. Please use the Q&A feature on the bottom of your screen. Instead of the chat feature, use the Q&A feature to put in your questions. You can put in the questions throughout the webinar so you don't forget them. And then we will be taking questions at the end. The webinar is also being recorded, so if you would like to revisit that later, you can. So yeah, please welcome them, and I will kick it off to Rich. Go ahead and share your screen, Rich.
Okay, let's do that. My screen up. Okay, everything look good there?
Looks good, Rich.
Awesome. Okay, so thanks for the introduction. I'm going to go ahead and jump into the slide deck here, and Julie and I are going to share the presentation on the SALA healthcare program. So I'm going to do the first part of it, and let's kind of start with why we're doing the SALA healthcare program and what our goal was. As she mentioned, SALA is my organization that I'm with. It's the Small Association Leadership Alliance. We are a membership organization just like the Chamber, and our members are other associations and chambers of commerce. And we provide a variety of management support services and program development services. And the reason why we got into this healthcare was that was the number one thing members were asking us for when we started SALA was, can you help us develop a healthcare program that we can offer our members? Where, you know, our biggest ask is a healthcare program. So we're not brokers, where you don't have background in the healthcare industry. We're association management people, and we put this program together for organizations like Steamboat. So what were the objectives? They were to provide a fairly simple approach to healthcare. With, as you can see from some of these bullets, we wanted to offer a high-end but affordable solution. One of the priority areas was half of U.S. businesses offer healthcare, and that data comes from the Kaiser Family Foundation. We wanted to offer a choice of affordable options. And the objective really was to provide a program that could be offered to our national organizations as well as our state level organizations and local organizations. But it had to be also able to provide some meaningful cost savings. So over the history of the program, which launched in the middle of 2018, we've been seeing average savings as much as 50 and sometimes 60% when compared to state exchange programs or traditional group insurance programs. And finally, that last bullet we're very proud of. As part of our due diligence, we periodically survey members, and we are very pleased to report that 91% of members participating in the SALA program have reported being either very or extremely satisfied with the program. So because this is a national program, and you probably understand that traditional insurance operates at the state level. So in order for SALA to offer a program across the country, we actually tried to put together an association health plan. It didn't work because the largest coalition of state insurance products that we could put together was 18 states. So that really didn't help our national groups. So in the process of trying to develop this program, we came across this approach that pairs two different products. And so there's some differences here between what you'll see with traditional insurance. I'm going to try to highlight and emphasize those so that you understand how the program works. And the first big point is there are two different parts of the program run by two different organizations that put together provide a comprehensive solution. So I'm going to be talking about the first part, the e-benefits administrator products, and then Julie's going to be doing the SEDERA medical cost sharing down there at the bottom of the slide. So let me just jump into this next slide because I think this illustrates it pretty well. If you think about your healthcare in three silos or three buckets, you have your preventive care, which is kind of your annual well visit, mammograms, colonoscopies, childhood immunizations, things like that. Then you have your day-to-day costs, which are defined here as sort of small and medium costs. They could be a cold, sinus infection, twisted ankle, flu, UTI, things like that. And then you have your large and unexpected costs, hospitalizations, accidents, unexpected serious illness, things like that. We'll kind of consider that the big stuff over on the left side of the slide. So the e-benefits products are designed primarily to handle your preventive care and some of your day-to-day small and medium costs. So I'll be talking about those first. And there's two choices of e-benefit plans to offer that we offer: the Essential Plan and the Summit Plan. So let me jump in. Now, this is Julie's slide, so I'm actually going to backtrack. So bear with me while I move over to the e-benefit side of the program. So two options. This is the Essential option. It provides 100% coverage for the 80 federally mandated ACA preventive care services. Those 21 services for adults, 28 for women, 31 for children. And they include things like I said, your yearly physical, vaccines, well checks, colonoscopies, mammograms, etc. This Essential program is the plan that provides the lowest cost of entry into the two products. So the people who enroll in Essential are the folks that will say, I never go to the doctor. I want the lowest possible price. What do you have? So that's the Essential. Now, in April of last year, both the e-benefits plans added a fairly robust virtual care component. So the Essential plan actually got a bit more robust when that was added. So while it provides 100% coverage, no copays for preventive care, you do go out of pocket on some of that day-to-day stuff. So you twist your ankle, you go to urgent care, you get the flu, you go in to see your regular doctor. Those would be out-of-pocket expenses and not covered by the Essential plan. So it's just the preventive services plus the virtual care. It does, however, provide a qualification to be paired with a health savings account. And if you're familiar with health savings accounts, they are a medical reimbursement program that allows pre-tax savings into an account. And unlike a cafeteria plan or flex spending account, it's not a use it or lose it type of product. So you can actually accumulate money in it, and it's convertible into an IRA for retirement savings. So we do have people that come in and they love the idea of a health savings account. And so they'll enroll in Essential. They'll have their health saving account, knowing that they may go out of pocket for something like the flu, but they're focused on accumulating pre-tax savings for retirement. As you can see here, health savings funds can be used for dental, vision, prescriptions, doctor's visits, things like that. And I don't have the 2023 contribution limits in this slide deck, but you can see the ones that were for last year. It's very comparable in this year. So that's option one, the essential plan. Option two is the summit plan. So it provides the same 100% coverage for the 80 federally mandated preventive care services. It has the same virtual primary care and virtual urgent care services that you can see here at the bottom of the slide, but it adds a copay framework for those day-to-day expenses. So you can go to your primary care for the flu or a sinus infection. You can see a specialist. You can go to a brick and mortar urgent care. It has labs and imaging in there, CAT scans, and a prescription drug program. So I would say probably 20% of our enrollments are in essential. The vast majority are in the summit plan, primarily because people have a higher level of comfort with the program. If they feel like they've got to go and they like going to their doctor, they're going to go see them if they get the flu, or if they have to go to urgent care, or if they're on maintenance medications like cholesterol meds or high blood pressure meds, things like that. The summit product does have the prescription drugs added to it. So here's the breakdown of the copays. So again, the preventive care services, 100% reimbursement, no copay. On the non-preventive services aspects with the copay framework, is $20 copay for primary care, specialists are $50, brick and mortar urgent care is $50, lab and imaging $50, and a CAT scan or MRI is $200. On the prescription drug coverage, it's through a company called Citizens RX, has extremely strong coverage on the tiers 1 through 4. With generics, there's one medicine that I'm on that actually is zero copay, but there are over 800 drugs that are dollar copay. And then you can see the breakdown here. On the first 4 tiers, there's no annual maximums or monthly maximums applied to those. Sometimes with psychiatric meds or brand name meds that fall into those tier 5s and 6, they could either be something that's associated with when you're using Sedera, such as a pain med or a chemotherapy med or something like that. And Julie will talk about that in a moment. But there are other options if the coverage doesn't apply to those tier 5s and 6 meds. We've had folks enroll in the GoodRx subscribe service to get the savings on those kind of medications. Julie will also be talking about a program to search out good prices on those kind of medications that Sedera offers complimentary to members. But for most folks, and like most plans, you're going to get really good, excuse me, coverage on generic medications in those first 4 tiers. So one of the differentiators with Sedera that Julie's going to talk about also is the freedom from networks. On the e-benefit side of the program, there is a medical network that you need to work within. It's the PHCS multi-plan network. Multi-plan was started by United Healthcare. It has over 900,000 participating physicians across the country. This search you see on the screen here is for my zip code in Maryland, where I just moved from yesterday. It's a fairly rural area. We were about an hour outside DC, and this is a zip code search for primary care physicians with a 20-mile radius, and you can see there were 475 results. There is also a process if the doctor you have that is not in network. There's a protocol for nominating them to be added to the multi-plan network. We've done a bit of that, and it's a fairly straightforward process. But if you don't do that, or the doctor doesn't want to go in network, starting in April of last year, we have added a out-of-network benefit to the program. So prior to that, you had zero coverage if they were outside the PHCS network. That's changed. Now it's 125% the Medicare rate for out-of-network services. So it's been vastly improved in that regard, particularly for some of our more rural areas. But we've never had an issue where a doctor said, no, I don't want to be in the PHCS network. So SALA can assist in that nomination process if your doctor is not in network. So Julie, I think we can come back to costs in a second, but let me just reinforce a couple of points on this slide. With the e-benefits pricing, what you see here is the enrollment types on the left column. So it's an individual, individual and spouse, individual plus children, or the entire family, member, spouse, and children. The center column is the pricing for the essential plan, and the right column is the pricing for the summit plan. And we can come back to the Sedera pricing, but you'll get, when you enroll, you'll have one payment each month, but because they're two different organizations providing for your healthcare in this program, that'll be broken out on the back end, and this is the pricing just for the e-benefits products. So what I'll do is, Julie, if you want, I can come back to this slide, but if you can unmute, I'm going to go ahead and switch back to your Sedera slides, and I will run them for you if that's okay. Okay.
Thanks so much, Rich. It's so great to be with you all this morning. My name is Julie Silverman. I am a regional sales executive for Sedera, and we'll be running through the Sedera slides to give you a good understanding of how this would work if you were to participate. So Rich, we can just jump on in there. So I always want to just level set with everybody, why we're looking at something a little bit different. Insurance has gotten quite expensive over the last several years. What we've seen is deductibles and premiums have risen significantly. And also the out-of-pocket cost that you would pay to have the care that you need has also gone up quite a bit, right? We're talking about the deductible at that point. And you can see on the screen here, this graph is showing you over the last 10 to 13 years, just how much it has gone up compared to what we take home and pay. So that green line, workers' earnings, the blue one, family premiums, that's what you pay each month to have insurance. And then that orange line is the deductible. So what you pay before the insurance company will help with your bills. And we call this the unsustainable squeeze, right? It continues to get more expensive. We don't take home as much money and pay. And it's hard to be able to afford care any longer. So kind of jumping into this, we're not insurance. Sedera is not an insurance company. When you join Sedera, you're joining other people around the country who are contributing to a community fund. And when someone in the community gets a medical event where the bills start to get more expensive, we use that fund to help pay for their medical care. So we'll kind of keep going here and talk about what this would look like if you were to participate in this non-insurance approach to healthcare. So just kind of some highlights here. Every member with Sedera is a cash pay patient. It's a large number of people that are participating in this across the country. We're all consumers of our healthcare. There is no network when you're a Sedera member, kind of going back to that cash pay model, which we'll talk about in just a moment. Everyone is committing that they'll strive to live a healthy lifestyle. And then there is sharing or help with medical bills on a per incident basis rather than throughout the calendar year, which we're going to talk about in just a moment. So we at Sedera look at everything in terms of a need. And when I go through this slide, I want you guys to all think about the large, typically unplanned medical events that happen, right? Think about a heart attack, stroke, a cancer diagnosis. Maybe you're on vacation or you're just skiing in the mountains and you tear your ACL, you need to have surgery. Or maybe you want to get pregnant, you want to start your family. I guess that's the one exception to the unplanned. That could certainly be a planned event. But that's what Sedera is there for. We're there for the large medical bills that if you didn't have something in place, it would be very difficult to pay for those medical events. So at Sedera, we look at everything in terms of a need. A need is one or more medical expenses caused by a single accident or a single illness. Each member, when they join Sedera, they choose the initial unshareable amount. We call that the IUA for short. That's what you as a member would pay before the Sedera community would help share in your medical event. So you'll see there's several different IUA options here on the screen: 500, 1,000, 1,500, 2,500, all the way up to 5,000. You get to choose the amount that would work best for you and your family. And that's what you would pay again before the community would help share your medical bills. So I'm going to give you an example here of how this would work with Sedera, and I'll use myself. I chose the $1,000 IUA when I joined Sedera about 6 years ago. Let's just say that I'm riding my bike here in Austin, Texas, where I live, and I get in a really bad accident. I can't move my legs. I have to take an ambulance to the emergency room. When I get there, the doctors are taking x-rays saying, Julie, we think it's broken. We're going to put a cast on you today. They send me home with crutches, pain medication, and then 3 months down the road when the cast comes off, I might need some physical therapy to heal from the accident. Because my IUA is $1,000, that's how much I would be responsible for paying for this incident, and the Sedera community would share the rest of that cost. Now, when I walk into the hospital, one of the first things the billing department is going to ask is, Julie, do you have insurance? And my response as a Sedera member is, no, I don't have insurance. I'm a cash pay patient. I'm happy to put the minimum requirement on my Visa, my American Express today. Please send me the bills for this visit. And it's my responsibility as a Sedera member to collect the bills as they come in. I'll upload them using the Sedera member portal. It'll ask a couple of medical questions about what happened. Open up the camera on my phone. I'll take images of the bills, hit send. It'll come to the Sedera team, and we facilitate the sharing of funds across the community and send the funds directly to the member via direct deposit so that they can pay back their provider. So a couple reasons why it's very beneficial to be a cash pay patient. The first reason, you oftentimes see a discount. It is common to see anywhere from 20 to 60% of a discount as a cash pay patient. It's also great because there's no network limitations. Maybe you're traveling to visit family and you get in a bad accident, or maybe you're on vacation and something happens, right? The nearest hospital is where you have to go. You're not concerned about being out of network because you're cash pay. There is no network with Sedera. And then lastly, because we look at everything on a per incident basis, we are trying to help with making sure that you're not out a significant amount of money each year. And so we limit the number of IUAs any household would have to pay to 3 events per year. Meaning if I had a 4th need, what Sedera is saying is, Julie, that's been a really rough year for you. Don't worry about the 4th IUA. The community will step in and take care of this for you. So three IUAs max per household for the membership year. So Rich, we can jump to the next slide and we'll take a look at some examples of medical cost sharing. So this is a story from my colleague. He has 3 little boys at home. They had a $5,000 deductible with their insurance plan. His youngest son was having really bad ear infections. They tried antibiotics, they tried booster shots. Nothing was resolving the ear infections. So he was referred to an ENT to have ear tubes surgically put in at the local hospital. So we'll take a look at the next slide and see what that looked like from a payment perspective. So on the left-hand side, you see the several different office visits where he paid a copay, then they tried the shots, eventually down here, surgery, right? Roughly $2,100. Total out-of-pocket cost, $2,500 because he hadn't met the deductible. Now, had he been a Sedera member with a $500 IUA, you know, he may have paid the first couple of office visits cash and paid a little bit more. Or had he had one of the e-benefits plan options that Rich discussed, he may have had a copay very similar to what you see on the left-hand side. But at the end of the day, when it came time to have surgery, he would have met that $500 IUA and the rest would have been shared with the community. Now, this actually happened in the fall. The following springtime, the ear tubes fell out of the child's ears, and they had to repeat this process all over again to put the ear tubes back in. And as we all know, deductibles reset at the end of the calendar year. So my colleague paid another $2,500 to have the ear tubes put back into the child's ears. Had they been a Sedera member, we require you to go a full year without symptoms or treatment for it to be considered a new need. In the springtime, it's only been 5 or 6 months since the original ear tubes were put in. So he would not have had to pay another IUA. It would have been shared with the community. So you can kind of see, you know, a medical need with Sedera, there's no timeline. Nothing resets at the end of the calendar year. It could be going on several months, even potentially a year, years. It's not until you go a year without symptoms or treatment that we consider it a new event. We want you to get better before you incur more bills for the same issue. We do have some limitations around pre-existing conditions. This is quite different than what you're used to with insurance. We define a pre-existing condition as something that you've been treating or something that you've had symptoms for within the past 3 years. So in other words, if you're thinking of joining Sedera, we ask that you do a 3-year look back on your health, anything that you've been taking medication for, seeing the doctor for, or maybe you just have symptoms. You know, even if you haven't been to the doctor for it, you know that those symptoms are there. If you join Sedera with a pre-existing condition, the first year of your membership, there's no sharing of community dollars to treat that specific pre-existing condition. In year 2, we open that up. We allow up to $25,000 of sharing to treat those pre-existing conditions. In year 3, up to $50,000 of sharing. And then 4th year of membership, it becomes shareable as if you never had the pre-existing condition. I am going to read that footnote there in red. There is a $25,000 sharing limit for tobacco users over the age of 50 for the diseases that are related to tobacco use. So things like heart disease, stroke, COPD, and cancers. So if you're a tobacco user over the age of 50, you have to know that we are going to cap how much money we're asking the community to share to $25K for those types of diseases. And now we'll talk about some resources that you have access to as a Sedera member. Medications is a very common question that we get. I know Rich touched on the medication options through the e-benefits solution. We at Sedera will share the curative drugs. So these are generally the ones that you're taking short term, things like antibiotics, pain medication, chemotherapy drugs to treat a cancer diagnosis. These are oftentimes administered in a hospital setting, but these are included with your need. So you'd submit these drugs to be shared just like you would any other bill with your medical event. It's the maintenance medications that we handle a bit differently. We do share in maintenance medications for the first 120 days if it's a brand new diagnosis. But after that point, we encourage our members to shop for their meds. We built out a marketplace for you to type in the name of the drug that you're taking, and it will pull up all of the options for you to purchase that drug, whether they're local, a mail order option, even patient assistance program to get those more expensive drugs directly from the manufacturer at little to no cost. So there's certainly ways to find affordable medications as a cash pay patient. If you've ever used the app GoodRx, it's very similar to that. A great option for finding good pricing on your medications. And yeah, we talked about the marketplace. Great. So with Sedera, you get access to telemedicine. Because you all will have access to the e-benefits products, that's usually going to be your one-stop shop to call and speak with the doctor over the phone. There is the option to use our telemedicine service as well. We can certainly have those options available for you, but it's an unlimited call to speak with a doctor, a board certified physician over the phone at no cost to you. They can write prescriptions to your local pharmacy, hopefully eliminating an unnecessary trip to the doctor's office. There's also additional behavioral health and dermatology consults available. There are fees for those consults. $85 a session, I believe, is where that starts. And then the last slide I really had for you all today, all Sedera members get access to Second MD. Second MD is a network of the nation's top doctors at centers of excellence. These are places like Johns Hopkins, MD Anderson, Mayo Clinic. They're there to give you just an unbiased second opinion. Maybe you're being told to completely change your medication regimen, or you've got a condition that you've been dealing with for a long time and you just really feel like, man, I wish I had another set of eyes to look at this. I'm not sure what's going on or if we even have my diagnosis accurate. Second MD is a great place to turn. It's a web consult just like this, with an expert physician, and completely free for our members. They would give you a write-up on what they recommend you do as a next step, what medical care they would recommend with the most up-to-date technology and studies available to them. We do incentivize our members if they're having any type of non-life-threatening surgery that can be scheduled out. We incentivize you to consult Second MD. We'll lower your IUA by $250 just to get the consult. If you decide to go with their expert second opinion, or you decide to go through with the surgery, it doesn't matter. Your choice is yours for your own healthcare. We just want to make sure you have all of the options in front of you. And if there's the chance that you don't need surgery right away, and you can try physical therapy, chiropractic care, something else before turning right to surgery, we want you to have that information available to you. So that's Second MD. It comes free with your Sedera membership. And then you've got a wonderful team of member service advisors who are here to help you utilize your membership as best you can. We realize not everyone has been a cash pay patient before, so we've got just a really patient, helpful team here to help you navigate the system. Whenever you have questions, we're just a phone call away.
So I'd like to kind of make a comment here and give you guys the benefit of a personal experience. So if you recall at the beginning, we had that 91% satisfaction rating. So we survey members to find out how the experience is going. And the feedback we get on the Sedera member support is off the charts. People love when they are working with those folks. And Julie, pretty much everybody is assigned a needs coordinator, right? So it's not like you're going to call in and talk to different people each time. My experience was I had the same person through my entire thing. Is that true?
Yeah, when you have a medical event with Sedera, you're assigned a needs coordinator to work with you through the duration of your need. So yes, you're interacting with the same person at Sedera and until your need is finished.
Yeah, so that's comforting. And my personal experience was, this is kind of an interesting story. My daughter had an allergic reaction to some medications, and part of the kind of the points I was trying to make about understanding how the program works with the two different components. On the preventive side, when something goes from preventive to diagnostic, you shift over to Sedera. So when my daughter had the allergic reaction, that wasn't a preventive care visit, it was a diagnostic visit, what was going on with the allergic reaction. So that bill wasn't paid. So I get the bill after it was sent to e-benefits, and it was for $5,650, which made my wife and my eyes fall out. So I said, I think we better, I had a $1,500 IUA, and I said, maybe we better send this over to Sedera and figure out what's going on. Well, At the end of the day, we didn't even need to use Sedera because the bill had a cash pay price for it, which was $330. So we went from 5,650. They were trying to bill insurance to $330, which didn't even get close to my $1,500 IUA, and we were thrilled. And the member advisor we had that was helping us with the process was super great. And it was actually, if I'd read the thing more carefully, I could have figured it out for myself, but the support that they provided through the whole process was incredible. So that's just sort of a personal endorsement on that. Let me go ahead and step into the pricing. We can talk about that. Julie, did you want to touch on any of these slides here at the end, or?
No, that's okay. There's quite a few of them, Rich. We can jump to pricing.
Okay, good. So these red arrows, my partner Kevin, who's involved with SALA, he has a chronic rheumatoid arthritis condition. So we use him as kind of the pre-existing example. And he had to disclose his RA, as Julia described. He had that phase-in period where there was no sharing in year one, the cap in year two, the increased amount in year three, and then full sharing beyond that. And the way he approached it was he got with his doctor and determined that his RA condition was well maintained. So there was a very low risk complication. He had his annual visit, he had his RA maintenance medications, and felt that it was fine to enter the program. It was an incredibly low risk of anything going wrong. So that's kind of how he evaluated whether or not it was a good fit. Now, sometimes if you're dealing with like an active cancer diagnosis or something like that, this program's not right for you, because those will not be covered in year one. But for a lot of people with pre-existing conditions that are, as I say, well maintained or resolved, it's great. And those restrictions do not apply to your overall membership. It's just that specific incident. So the red arrow is Kevin. So Kevin's an individual in his 40s. He enrolled in a summit plan. So $172.62 is his monthly price for that. Again, it has the copay for his rheumatologist. That's handled in the specialist part, and his maintenance medications are handled through the Citizens RX side of the program. So $172.62 for e-benefits. Then, as Julie described, there's 5 IUA choices. The pricing is a little more granular. You also have the same membership types on the left with the individual, spouse, children, and family, but it's also broken down by age band. So Kevin selected the $1,500 IUA, and we're showing 1,000 and 1,500 here for space reasons. And he's in his 40s. So the amount he pays for his Sedera part of the program is $136. His total monthly cost is $308.62. He was on the Maryland Blue Cross Blue Shield exchange, paying just under $600. So his savings was a little bit under 50%. But I think it's a good example to show you the kind of savings that are available to you in the program. So I'm going to drag over Steamboat's page here in a second, but on this page you can find rate sheets. You can find all your important documentations like the Sedera member guidelines. This says Apex Basic and Advantage. I'm sorry, the slides needs to be updated. Those are the branding prior to last April. So you'll find the e-benefits, essential, and summit plan documentation. And down at the bottom, there is a search instructions article that tells you how to get into the multi-plan provider search to look up your doctors. So to reinforce a couple of points here, there's no minimums in this program.
Rich, we can't see, if you are navigating the chamber page, we can still only see your slide.
I'm going to bring it over in just a second.
Okay, great. And I also linked it in the chat for everyone.
Perfect. Okay. So no minimums in the program. You don't need an employer sponsor. Individuals can join directly, or we can run it through what's called a list bill, which is a centralized invoicing where everybody within a company just goes and enrolls directly, and they're all put together on one invoice. If that's how you'd like to approach the program, I can talk to you about that. There's no restrictions on employment status, so full-time, part-time, seasonal can join. We have a lot of folks that work ski resorts in the winter, and then they may shift over to a landscaping for the summer months, for example. That's fine. And I mentioned the employee can either pay directly or it can be run through the employer. with savings of possibly 50-60% on healthcare. And there's a dental program option that we have as well. Okay, let me drag over this slide. Web page browser, I mean. And if you go here and you click on SALA HP, so that's healthcare program. Over here, there's a an on-demand recording of this video. We have this little online tool that lets you put in different IUAs and so forth, and kind of do your pricing online. And within each of these expanding boxes, you'll find all the documents for the program, so you can go through and get more detail about it. Here's the PHCS search instructions, information about Sedera. The virtual care that's bundled now with the benefits is called Recuro, so that information's here. And the dental is down here at the bottom. So you can find pretty much everything you need here. We also have a knowledge base that has a lot of articles and specifics on how to use the program. Now, let me just close by saying, so SALA is the program sponsor. You would obviously be working with eBenefits and their administrator on claims for those parts of the program. You'd be working with Julie's team when you use Sedera, but SALA kind of sits here as a concierge service. So we run our own help desk. We have our own knowledge base and a ticketing system. So, you know, if you get hung up on when you're crossing over from an eBenefits type of service and you need to start using Sedera, or you're not sure who to contact about something, we offer that kind of layer of customer support also. So if you need to get a hold of us for anything like that, the HP support at smalassociations.org is how you do that. That goes right into our help desk. A ticket is created to make sure nobody falls through the cracks, and we'll help you, direct you in the right ways to use the program. We also handle updates to billing, adding and dropping dependents. So we'll coordinate all that between the two parts of the program. And yeah, and just kind of here to do this kind of presentation for you. If you want to go offline and talk about any pre-existing conditions you might be handling, or prescription drug questions, we can do that too. So I guess we can jump into questions now, if you like, and we'll do our very best to answer them.
Yeah, so Julie and Rich, I'm going to be taking the questions that are in the Q&A, and for everyone else, I see some people putting questions into the chat. So we're going to be answering questions in the Q&A. So look at the bottom of your screen, you'll see Q&A. Please type your question into there. Also, just some background on the program, like Rich said. So access to both of these programs you can get through your chamber membership. So if you are a chamber member business, your employees, you are eligible. If you're not a chamber member business and you would like to join to get yourself or your employees access to this program, please reach out to me and we can chat about that as well. But I'm going to start, Rich, some of the most common questions we have are, you know, what is it like when you search for the Steamboat area for providers, you know, the Oak Creek, 80487 zip codes, 80467 zip codes. And so, yeah, I just did a search. I live in Oak Creek. So I just did a search for Oak Creek and I can see 2 providers in there right now. But Rich, could you maybe help answer those questions?
Yeah, so sometimes, because it's a keyword search, it can be a little finicky. We can run a directory though, a zip code based directory, which will include everything. So if you want to email me at that HP support at Small Associations and give me your specific zip code, or if you just want to do that through the chamber and you can just send me a list of zip codes, I can run those directories for you and you can distribute them to members. That's probably the better way to do it, because in some of the more rural areas, the search can be a little finicky. But as I mentioned, there is an out-of-network benefit. It's 125% the Medicare rate. So it's not like it was in 2022 and before, where you got 0 coverage if you couldn't find an in-network provider. Now it's going to be at least 125% Medicare. And the administrator for eBenefits is super great. I love these people. They will absolutely work with any doctors that you want to use and see if we can get them put into the network. So we just need to go through that little nomination process. That's another thing SALA can help with. If you just want to send me the practice's name, we can start that process for you.
So if we have a provider here who's out of network, we can always nominate them that we want to use, and you
Exactly.
guys can work us through that process. Okay, great.
Yeah, and the payout rates are really good. Again, I'm not an insurance expert, but it is my understanding that the multi-plan network is very competitive, and we have not had anybody who said, "No, I don't want to be included."
Awesome. So next question for you guys, how is this different from Christian healthcare plans?
So Sedera is open to everybody, regardless of your religious affiliation. We all commit to certain principles of membership that we're going to strive to live healthy, balanced lifestyles, that we're, sharing in each other's medical bills. So there's some things that we're all going to agree to based on the membership guidelines, but you don't need a faith statement of any kind. We accept members from all walks of life.
Thanks, Julie. So next question, there's two of these that are kind of similar. And so what are considered pre-existing conditions? What types of illnesses are considered? And then you kind of touched on this, but any other clarification on what's the policy for pre-existing conditions?
Yeah, I know this is going to sound very general, but a pre-existing condition can be anything that you've dealt with over the last 3 years. Do you have any pain in the body? Like, do you have back pain that you know about, but you haven't been to the doctor to treat it yet? Did you have a diagnosis of something within the last 3 years? Do you have asthma? I have eczema. It flares up, certain times of the year. Anything that you've been treating, have seen the doctor for, or have symptoms for is considered a pre-existing condition. And those sharing limitations are going to apply the first year. And now it's up to you to take a look at your health history and say, well, my eczema is not really a huge deal. I can get access to my, primary care doctor to treat it once or twice a year. And I'm not concerned about this becoming an issue. Or is this something more serious? And is the first year of not having any medical care, not having any funds to share towards this medical event going to be really tough and really expensive for me the first year? So you really just have to take a look at, what is it specifically that you're dealing with or could potentially be dealing with that you know about now? And I think Rich mentioned this also. We can chat privately about your specific situation offline. If there's specific questions you have about what you're going through, what a family member is going through, let's talk about it. Because the last thing we want is someone joining Sedera thinking, my back pain, because I haven't been to the doctor, I'm expecting Sedera to take care of my back surgery the 3rd month of my membership. We don't want that. We want you to know what you're getting yourself into and feel comfortable and confident joining a community of people to support you when you need it. So reach out to the phone number or email that you see on the screen if you have specific questions about pre-existing conditions, but it could be anything, symptoms, treatment that you've been dealing with within the last 3 years.
Thank you. So how do the IUAs play in with all of the other copays for procedures?
So if you're going in for something preventive, right, you're going to use your eBenefits card. Once it turns diagnostic, any of those bills will go towards your IUA for whatever it is that you're treating or trying to figure out what's wrong. In the same regard, a copay will count towards your IUA as well. So, really once it goes from preventive to, okay, we're trying to fix something. We've found something, we want to fix it. That's when it becomes more diagnostic in nature. It'll go towards your IUA, and anything that you've paid towards copays will count towards your IUA as well.
And a good example of that is a colonoscopy. So you'll have a preventive care colonoscopy. You'll go in, it'll be through eBenefits. The doctor's visit will be covered, the procedure will be covered, but let's say something comes up in the procedure that's questionable, and like a polyp or something, or they need to do a tissue sample or something, that all of a sudden it becomes diagnostic because they're like, they found something and they need to kind of take a closer look at it, that's when you sort of are shifting over. And we understand that that can be confusing and sort of understand that. So that's why we run this help desk. So if anything like that comes up and you're confused about, how to use the two parts of the program, we're going to be there to help you through that. And as Julie will tell you, if there's any question, just call up member services and open a need, and they can advise too on that sort of thing. And you can get that other layer of customer support.
Thank you. Can you change e-benefits plans at any time?
Yeah, so that's a good question. There's two parts to that. One, there's no open enrollment with our program, so you can join at any time, you can leave at any time. You can also switch between the programs. That's pretty easy to do. And the only date that really you need to remember is the 18th. So that's our cutoff. That's when billing begins, and we can't really retroactively go back and start changing stuff after that. So anything submitted and processed prior to the 18th will take effect on the 1st of the following month. If it's after the 18th, it's the month after that. So we're in June, late June now. So changes in new enrollments and cancellations are all taking effect for August 1 now, because the 18th was the cutoff for July 1. So yeah, dependent adds, dependent drops, changes between the two e-benefits plans, cancellations, and new enrollments all have to be in prior to the 18th.
Thanks, Rich. So I'm not sure I understand this question or what the question is, but Steamboat charges considerably more than 125% of Medicare rates for out-of-network coverage. With your PHCSE benefits, I am cash out of pocket for care that exceeds the 125% Medicare rates.
Yeah, that's true. Yeah.
Okay.
And that's where e-benefits administrator will jump in. And they've actually, in Vail, they worked with the hospital system there because they were getting balanced billings, which is basically you go in and the plan covers a certain amount, and then the rest is billed to the member. The administrator actually contacted us because they were seeing a lot of balanced billings coming through, and they were concerned about that. So that's when I really got impressed with this company that we went with last April. They wanted to get ahead of it because they knew that wasn't a good situation for members. Long term, it wasn't good for our program and their business. So they initiated a contact with the hospital system there to try to figure out how billings was working, try to nail that down to make sure members weren't balanced billed. So they're proactive in that. But yes, the minimum will be the 125% the Medicare rate. But if we get into situations where there's big differentials in balance billing, that's probably we'll see the group jump in. They're called ARM, Alt Risk Management, and they'll probably jump in and start trying to work something out.
Thanks, Rich. How does SADERA handle breast cancer? Is there a cap on services?
So a new breast cancer diagnosis would be a shareable event with SADERA. No, there's no cap on sharing, but I would encourage anyone that's interested in very specific things that are shared or not shared to read through our member guidelines. And I believe Rich said there was a link to the guidelines on your website, on the Steamboat website. So, it's a longer document. I know healthcare is not the most riveting read, but I think it will give you a really good sense of what the community shares, and kind of who we are, what we're there for. But just to kind of answer your question, yes, breast cancer is a shareable need with SADERA.
And then before someone joins, can they discuss with a sales rep what is pre-existing or not? Like, can they have a conversation with someone one-on-one to chat through those things?
Absolutely.
Yep, absolutely.
Thanks. So this is a good question. Is it cheaper to go directly through SADERA? Is there a reason to go through the SALA program instead of direct?
Well, your SADERA is going to be discounted because it's paired with the e-benefits program. So And keep in mind too, Sedera is not going to handle your preventive services. So what Julie presented is what you get with Sedera. So this pairing really provides for a more complete healthcare solution. But yeah, there is a discount off of what you would pay going directly to Sedera because you've got the e-benefits part already taken care of.
Is there a cost limit to preventative care such as mammograms or colonoscopies?
Not that I'm aware of, as long just the network, in-network, out-of-network thing. I don't think there's a maximum benefit, and they don't have negotiated rates or anything like that. I don't recall anything since we've offered the program that where there was an amount that wasn't covered if it was a preventive service.
Is the pricing you showed for monthly payments for each program?
Repeat that.
Is the pricing you showed on monthly payments for each program? I'm not sure if you want to get more specific.
That's basically your premium, right? So this bit, right? So you had the e-benefits summit and then the $1,500 IUA for Sedera. Yes, that's your monthly contribution to the program. So that handles your Sedera monthly contribution plus your enrollment in the e-benefits summit plan.
Is an annual dermatologist visit preventative, or is there a list somewhere that we can see access, where we can see access to see what's covered with e-benefits?
Yeah, on the website, there's let me see if I can bring that back up here. There's a sheet called a schedule of benefits. So right here, SOB schedule benefits. So that if you click on that, it's going to bring up a PDF that will show you everything that's covered. And so it's just basically a big matrix and it goes through all the stuff. So yeah, that's where you'll find those.
Thank you. If there is an ultrasound, a breast ultrasound recommended annually to someone who is high risk, is that considered preventative? Again, yeah, a lot of these questions are very specific, but yeah, if you guys could answer that, otherwise, we can offline it.
I'd probably have to ask the administrator about that. I'm not sure offhand, but I'm happy to do that.
Great. And then, maybe.
Oh, and you can you kind of consolidate all these? Because I'm not taking notes. Are you able to
Yes.
kind of, okay, thank you.
Yeah, I'll have all these questions saved and send you guys a follow-up. Yeah, there's still a couple
Awesome.
questions coming in about providers in the area. So if you missed that answer, I'm going to provide Rich with all of the zip codes for Routt County, and then I will send out a list of all and any providers in the area to everyone who is on this call and anyone registered.
Yep.
So do you have to sign up for e-benefits and Sedera? Could you just sign up for one or the other, for just Sedera or for e-benefits?
Well, you don't get the discount with Sedera, and of course, we're obviously concerned that people have their day-to-day healthcare covered, and if they're on maintenance meds, they have access to the prescription. So technically, you could go to Julie and sign up directly with Sedera, but the pricing is based on both components being enrolled in. There are occasionally people, and we've had this with like with a couple of landscape companies where they had summer seasonal folks, and they just wanted to provide their preventive care, and so they would sign up just for the e-benefit side. And to be honest with you, that makes me so nervous because there's nothing there if they had a car accident or any e-benefits is not going to help you. And so yes, it is technically feasible or possible to enroll in one or the other, but the program is really paired to be the best approach for your complete healthcare.
Thank you. Okay, so we're reaching the 10 o'clock hour. If you have any additional questions, please, you can email myself or Rich or Julie. I'll provide their contact information along with the recording at the end of this webinar. One thing I wanted to share with you guys is if you have any questions about joining this program, we are happy to connect you with the experts here at the chamber. So we're not kind of gatekeeping any of that from you. We want you guys to be able to ask questions and to be able to connect immediately. So if you have any questions, if you're a non-member or a current member, please, please, please don't hesitate to reach out. We will be sharing this with all of you guys. So you no need to take notes. We'll be sharing the recording. We'll be sharing this. And then I will send a follow-up email with all of the resources we talked about. But I also just wanted to say another thank you to Julie and Rich for being with us this morning. Healthcare is complicated, and it is one of the #1 things we see pop up in our membership survey every year. So it's an issue that we are actively tackling here at the chamber and trying to connect resources and stakeholders together to help businesses in the Yampa Valley. So thank you guys for being here, and have a great day.
Thank you very much.
Thank you.